So the last 2 days,
Yeah.
you've had this hip flexor restriction.
Yeah.
Is that right? So you're walking around like, oh my God, what's going on?
Yes.
Right, okay.
Yes.
Okay, so what do you reckon led to that?
There would have been the combination of bike,
Okay.
combination of kicking, and combination of...
Oh, right, because, yep,
Just-
right, yep.
I did
No.
a big volume of kicking,
Yep,
and combined with the driving and then the cycling,
Yep.
it's just overload that. So that got really tight.
Yep.
I wasn't feeling it through the glute.
no.
That's only come on in the last 2 days where I've gone,
Oh, right,
yeah,
okay.
It's really...
Okay, yep, no worries. So Dave, for those of you that are not aware, but Dave is a cyclist, so he's an amateur cyclist, but he's an absolute cracker. Also, as his occupation teaches young kids, well, not just young kids, but obviously a whole range of adolescents how to kick AFL football, which incorporates a lot of this all the time. Will have an influence on your hip flexor. But then you get on the bike and then you ride, we're talking road racing, and you're obviously shortening through there as well. So you have a lot of influence going there. Then you're asking the glutes to kick in because they're your powerhouse. Then you start to get stiff and loaded there.
Yep.
So that lack of hip extension for you is not ideal, is it?
No. They described it to a T.
And we've done your pro knee bend on this side, on this right side. So what we can deduce from that is that you have a really friggin' tight rec fem through this side. So that's going to be part of it. We definitely will clear out both, but before we do that, obviously we need to nail that trigger point here, the hip flex, because that's the poo for you. Given you doing this all the time, then this, you need to be opened up through there before we address your glutes. The good thing for you is, but if I just quickly assess, and if I remember rightly, because we did this beforehand, like you got really good internal rotation. But when I get there, where do you feel that? Anywhere?
No.
Good. Right. Let's just say you did, and you could feel it here, and you could feel it out here, which is TFL, rec fem, or then the adductors, because that means then we have to address the hip because you've got a restriction through your hip. But at the moment, what you've got is just overload, which is happy days. We want to work through overload. That's not a problem. But if you stay in that scenario, then when you do go and race and then you put it under load, then there's the chances for the lower back to start to kick in. You're getting aching through your lower back because you're starting to fail through here, you short through here, then you're chasing those symptoms around a little bit. So let's start with hitting this first, then we'll clear your rec fem, then we'll hit your glutes. Might be worth testing and just seeing what's going on in your QLs as well, knowing that you're going to sit in that flexion sort of scenario. Now, normally, if we're in the clinic, we would have a height adjustable table. So I could just raise it up and sink in. But we don't here today, so therefore I have to adjust myself. So I'll just bend the knees, sink in here. Okay, so we get that ASIS. We know the lesser trochanter is over here. So we know the trigger point for iliopsoas attachment onto the lower trochanter. And right next to it we have the rec fem. And that attaches onto the AIS. So we're going to come onto the rec fem one because that's where most of your restriction is. I don't necessarily feel that it's the psoas trigger point. It's more rec fem for you, which makes sense given the cycling and the kicking component a little bit. So we'll sink in here. Can you handle that?
Yep.
Is that too much? Talk to me.
No, it's fine.
So before we were on the other one, weren't we?
Yeah.
Yeah. It was this one, wasn't it? So we tested it a bit for. What you probably don't know is I have worked on Dave before, so he's sort of quite used to this. But I actually had a young female soccer player in this morning, classic hip restrictions, not on the kicking side but the balance side. So definitely had restrictions in that adductor magnus in relation to her hip, and definitely hip flexor, was having hip flexor symptoms, which come and go. So she played, trained, she's got a big, beautiful boot on her, so she can really kick the ball powerfully in a long way, but would end up with this hip flexor issue all the time loading up. Yeah, that's starting to sink in now. All right. So I checked her hip and she definitely had that hip restriction there, so we cleared out the the rec fem, really tight, short rec fem, cleared out the attachment here, and like literally just had to sit on it. It was the first time she'd had that attachment soreness and had that attachment treatment. So you remember the first time I did it on you, we just sat and sat and sat, and it's just, slowly. It's like, it pushes you out to start with, but then it starts to open up and let you in, and then that whole anterior hip just opens right up. And so now you can feel me sink. See how I can just put my whole body weight in here now? And that's just opened up beautifully. Just, oh yeah, that's gold. That's lovely. I'm right on the bone there now. You would have been, yeah. But that's, I mean, that's me putting weight on it too. That's what we want. So that's clearing that there. Right, so now we're going to use, so when I'm doing this sort of myofascial work here, because I know you're tight through this rec fem, it's when we use the original, because it's just got a little bit more grip. It's not as slippery, so I just need to engage the tissue on a little, it's not like a general massage where you're just dealing with flushing the muscle. So I really need to engage the tissue on this. And then we do this, and then we'll hit your glute, and it will be special. Okay, so we'll hit this rec fem. So I'm going to do it two ways. I'll have it in extension first, and then we'll put it on the table and hit it while it's on stretch. But I just want to hit it this way first. Just get a bit of an idea. Geez, you've got bloody dry skin, haven't you? Yeah. If that's the case, he's got a little bit more dry skin. Just probably add just a little bit extra than I normally do, just so it doesn't stop like it feels like I'm shearing the skin. So it's a fine edge in terms of getting the right amount of cream, not having too much and not having too little. So in terms of engaging the tissue, how do I do that? Two ways. I take the tissue up as much as I can towards, lock out the skin, and then I come across. Okay, now I'm locked down onto that tissue now, and then it's just a gentle pressure on, and it's all directed that way. So now I'm challenging the tissue. I'm not trying to push through it, I'm just working with it. You can feel that, Dave? Absolutely. Yeah. If I'm doing it too much, then I can guarantee you his rec fem will kick in and kick me out, and I'll have unfortunately disengaged, which is not what I want. So it is a slow process, as you see here, just checking in. And if I remember rightly, Dave, all the tightness for you was in the upper half of this rec fem when we put you in your prone knee bend, didn't we? Yep. Yep, for sure. So just a slow process through here now. Yep, and I can feel it. That's the one. So you'll notice my body position. I'm coming over the top of this here, trying to keep my shoulder in line with my elbow, so that I'm not leading like so, because that's going to put a lot of pressure onto your shoulder. Do not want that. Okay, come up. I'll chase it a bit further up there, and now I'm going to hit a little bit of that upper part of that rec fem now. And remember, that trigger point is right at the very top, just below that attachment of the rec fem. Beautiful. Okay, right, now it comes off the table, and now I'm going to use more of a loose fist. So I might just put a little bit of extra on there. Same scenario again, except the only difference now is we're using a loose fist, and we're going to just engage the tissue. You'll see that I'll come back here, put my body weight through here, lock out my elbows, and then I'm just going to work along the length of this rec fem. Now I'm challenging the tissue now because it's on a stretch. That's what I want. I want it on a stretch. And then you'll notice the difference, Dave, after we've done this. Well, you've had it done before, mate, so you know what it's like. So yeah, look, given the amount of kicking you do, especially on your right leg, this has got to be a bit of a constant for you, because you are, you know, and then when you're doing the big volumes on the bike, well, I want to say big volumes, you know, when you're leading into a race and you're doing the big blocks of training that you're doing, then that's when you're going to start to feel this influence. Unfortunately for you, your glutes are you're going to feel it the most. Yeah. But the good thing is, you know, we've cleared out and done the hip protocol on you before, so we don't have those other restrictions that we used to deal with, which is great. Great, good, that's awesome. Righto, so let's come up here. Just want to check that again. Yep, that's good. Yep, good, right. Right, so now, piece of resistance, the glutes for you. So we'll clear out that rec fem, that anterior rotation, so that's good. So now we're going to hit these glutes for you. This is the only way I work the glutes these days. Back in the day, it was all clients prone, face down, and thumb work. Don't do that not unless you want to ruin your thumbs. Right, so once again, I'm going to use the Pre-Max Original because it's got the grip here, so I don't want to be sliding too much. I want to engage the tissue, sink in, and just explore that glute. So our greater trochanter sits right here. TFL is here, if you can see it. Come back from the TFL, then I'm going to be in line with that gluteus minimus, and then obviously the glute medius is around here. So all this area here is basically open for me to explore. And this is the key area for you, mate. This is where your load and your power comes from when you're on the bike and so forth. But at the same time, you load this up when you're kicking as well. So I'm going to lead in with basically a little bit of elbow and the fleshy part of the forearm. Perfect height, table. If I had the electric table, I could adjust it depending on what I want. So I'm going to come in, I'm going to find that greater trochanter. I'm going to roll off that greater trochanter. And then we're just going to sink into that tissue right there. That's it, Dave. Feel that?
Absolutely.
Yep. Not too much, but enough. That's okay, isn't it? It's going to work really slow just along that glute minimus. Yeah, that's it. So sinking in. Just really slow, really purposeful, right along the edge of that anterior gluteus minimus. Not medius, minimus. Yeah, that's it. So elbow is going to be in line with that sort of that shoulder area. I can come in, nestle it in towards me so that I'm not got any extra influence onto the shoulder. No extra pressure onto the elbow. I can sink in here and do a lot of work. How's that feel, mate?
I could feel it.
You can feel it?
Yep.
Any referral?
No.
Good. Okay, so all local?
Yep.
Yep.
Particularly on that lower point there.
Yep. Okay, so now I'm just going to come just almost an elbow width back from that greater trochanter. I'm going to pick up the posterior fibres of glute minimus now. So just pick up those. So the anterior can refer down the outside of the leg and the posterior down the lateral. Okay, working through there like so. Yeah, how does that feel, mate? Good. Yep.
I can feel it for sure.
Yep. Good. It's actually not too bad considering how you've come in sometimes. Yeah. Put it this way, when the tension and load is in that glutes, you don't have to sink in too much, and then unfortunately there's a lot of them trying to push out. So you then have to negotiate how much pressure you do and how much they can accept. So we can sink in a fair way with you, Dave, believe it or not now, which is great. Okay, so that's good. Right, now I'm going to come across to glute medius. Okay, so you can see here's your iliac crest right at the top here. If I draw a line around here, I'm going to come down, and this is the glute medius area I want to be involved in, right here. Okay, so not right up onto the iliac crest, just a little bit down. You've got the cluneal nerves that come off around here too, so if you punish this area too much, you'll get a lot of yucky feedback. And then they'll be really sore the next couple of days, and we don't necessarily know that. Dave is racing tomorrow, so we want to do enough that we can change, but not enough to make you sore. But you'll be able to push through it anyway. It's a different type of soreness anyway. And it's not the first time you've had this work. Okay, so this is glute medius now, buddy. So this glute medius, this is where, you know, it refers up into the lower back, into the SIJ, into your coccyx, you know, all those areas around there. How's that feel through there, Dave?
And I can feel that what you're talking about.
Yep, yep. So you're probably getting a myriad of sort of like symptoms going in different directions there, aren't you? Yep. Okay, same again. Just sink, so you can see I'm sinking over the table, leaning in, body work, really important if you're going to be doing these techniques. So you can see how diabolical this would be for therapist thumbs, mate. Just not ideal. No. Okay. You know all about mechanics, mate. Kicking the footy. It's important, isn't it?
Overload.
Yep. Don't want to be loading particular muscles in the wrong way.
Inefficiency comes in.
Yep, definitely. Yeah. Okay.
Feel that one everywhere.
Yep. That's good. Okay, good. Beautiful. Okay, that's great. All right. So that's glute minimus, anterior posterior fibres, and then we've also got the glute medius there. So that is going to go a long way. Now we quickly can do is let's just test a little bit of that QL and see what it feels like in there, hey? So what I might do, I need to open you up a bit there, mate, sorry. So let's pop this leg down here like that, that's better. Yeah. Once again, we're going to use an elbow through here. No, we need more, sorry. Need a little bit more slide through this area. So I've got to nestle my forearm in between your iliac crest and your last rib and then sink into that lower vertebra area. So that means I'm going to drag the hip down a little bit, open that up, the rib cage, nestle me in, snug in there. Lucky my forearms fit into these areas. I've got large-ish forearms, but just enough to be able to sneak the fleshy part of the elbow and the forearm. So I'm going to sink, right, so now I've gone there. Now I'm going to drag it back towards you, and then I'm going to sink in there. Whoa. Yep, that's it there. Can you handle that? Or will I back? Yeah. No, honestly, can you? Yep, that's all right. Yeah. That comfortable enough? I'll drag this pelvis down a little bit more so I can just get a bit of a... So now if I can move my elbow either way so I can hit the lower trigger points or the upper trigger points. All these ones here, I'm just going to hit those superficials. And we just sink here. Comfortable?
Yes.
Sure?
Yeah, yeah.
You tell me.
No, that's fine.
You know what? I'd know because you'd be pushing me out.
Yeah.
Yeah. And you're not, so you're just sitting there like so. That's good. So we just sit here and just relax. Just let everything start to just let the magic happen. Let it melt away. That's good. Yep, good. Listen to the birds. Okay. Beautiful. Okay, I'm going to slowly come out. And then a few more sweeps through here, really, really slow and purposeful. Don't need to do a huge amount onto this QL because it's not a massive muscle, so it responds quite well. Another one. That's it. Yep. Oh yeah, that's good. And just sink in there. Beautiful. Good work. You're going to win tomorrow? Hey? How far? Were you racing?
51. Only 51.
Nobles Road?
Yes.
Yep. Out and back?
Yeah. Bit of hilly stuff.
Yep. Yeah. It'll hurt. Scratch? Handicap?
A little scratchy.
What are you off?
Scratch. Sorry. So graded.
Oh, graded. A?
A.
Yep. You'll be under the pump.
Yep.
You'll know which wheel. You'll know which wheel to sit on.
There's a few
when to
ones
go.
out there.
the moment. It's good.
Pick your moments. Yeah. Do your efforts when you need to, and then pick
Pick the time.
Pick the time. Pick the wheel, pick the time. Always off. It's all good. It's all post Tour de France, so you guys are all pumped up. Good work. All right, so that's QL. So good. That's awesome. Terrific. Okay, so not unlike, I'll finish off with Dave because I'll do the other side, the other glutes.
Yep.
We'll hit that QL as well, and you should be good to go.